Hey everyone, Tony G here. So in today's video, we are going to be working on our gastrocs, okay, or our calf complex. Now, underneath your gastrocs is a muscle also known as your soleus. It goes about halfway through the gastrocs, and both of them are responsible for helping you propel or run. Now, because we're New Yorkers, we're always on our feet. This area tends to be very, very tense on a lot of people. So you might see some funny faces in this video, okay? Truth be told, even if you're an athletic population, you're going to notice that your calves can be very, very tight. So it's important to give them attention. Now, when you're working with percussion massage gun, you want to make sure that you are not driving the gun into your body as hard as you possibly can, okay? This is going to burn out your motor. These guns typically run anywhere between $60 to $300, and you don't want to necessarily break your gun trying to help yourself, okay? Let the gun do the work. You're simply guiding it, putting very gentle pressure. Some of the research says no more than 5 pounds. That could be a little bit hard for people, so I typically say just let the gun do the work. When you find a sore area, you're going to feel it. You're going to know, okay? Now, because there's so much overlap of muscles inside the leg, specifically in the soleus gastric complex, especially on the post-tib, at least for me, there's going to be a lot of trigger points in this area. Now, a trigger point is an overlap of muscles that causes a lot of tension and dysfunction into the body. So bear with it. If you do find this point, typically what you want to do is you want to hold the massage gun there for a few seconds until you feel a release. For some people it might be a little bit longer, for others it might be shorter. You got to kind of figure out what's going on with your body, okay? The name of the game is not cookie cutter, 2 minutes, go. No, it's you have to listen to what your body is saying. That's going to be the chirp that I continue to make on these pages, because all too often we've disconnected from our bodies and we don't know what's going on. So it's your job to make sure that you're listening to your body so that you can give it what it wants, so it can give you what you want, which is optimal performance, okay? That being said, we're going to turn on our massage gun. Now typically, because the calves run very, very tight, you're probably not going to want to go with the higher setting. Most guns go anywhere between 3 and 4 when it comes to intensity. I typically start at about a 2 just because I found that 1 does very little. But again, you got to listen to what your body's saying. So we're going to start at level 2. We're going to bring our leg up, keep our foot nice and relaxed, okay? If you plantar flex or dorsiflex your foot, this can create tension through the area. Excuse me. That can change the intensity and the feel of it. So I usually just kick my leg up and I'll run up and down, okay? Making sure not to forget the Achilles tendon, okay? Perhaps one of the most longest rehabs are Achilles tendon tears, anywhere between 1 to 2 years in rehab. So you always want to make sure that you are stretching and releasing it, especially because if you're walking around and you're very, very active, these areas get very, very tight. And you know, most of the demographic is typically about 30-something-year-old males tend to pop their Achilles tendon, and then they're gone. Then they're out for 2 years or a year. Truly a fear of mine, I'm going to be 100% honest with you, which is why I know so much about it. And keeping that in mind, I'm going to work on my calves, okay? Let me get my timer going. I forgot to set it. Okay, now the calves do run very, very tight because they tend to be a very, very dense muscle. So it's okay. Take your time with them, okay? Let me see that this works, okay? So what you're going to do, I'm going to typically grab my calf and I'm just going to trail along the inside. Now, in the front of your calf is what's called your tibia, okay? If you go too far forward and you hit your tibia, you're going to be hitting bone. The gun's going to recoil. You're going to feel it. It's not going to feel the best, okay? Try to stay away from that. However, if while you're running up your leg and you're as close to the tibia as possible, you are working on an area what's called your posterior tibialis tendon. People with flat feet, this is going to hurt like heck, but it's necessary because this muscle tends to get very, very, very tight, okay? And you're just going to work on the area. Just up and down, loosening it up, okay? Going towards the medial gastroc head, soleus there. Oh, got a little bit of a trigger point right in that mark. I'm going to hold it there for a few seconds till I feel a release. Sometimes it takes a little longer. And I'm going to relax, okay? Now, I'm just going up and down, scrolling the muscle, kind of working my way around it, feeling for any areas of tension. Remember, if you find an area that's very, very tense and you're like, sucks. Hang out there, okay? You don't want to ignore these areas. It's the body doesn't work in the sense that if you ignore it, it gets better. It's actually going to continue to get tighter and tighter, okay? There's something what's known as the pain, spasm, pain cycle, and where pain causes a muscle to induce a spasm. That spasm irritates nerve fibers and causes pain. That pain kicks on the spasm, and round we go, the merry-go-round of pain, okay? You want to interrupt the cycle. That is the whole point of a foam roller or a myofascial release or a percussion massage, which kind of all contribute to the same thing. So you want to make sure that you're working on this area. So I got about 2 minutes on the inside, and now I'm going to drop my leg and I'm just going to work on the outside or the lateral gastroc head. Very hard to do this when your knee is bent, and sometimes this area does often get ignored because we only really focus on the inside because that's where a lot of tension tends to be. But you don't want to do that. You don't necessarily want to ignore one part of your musculature as compared to the other. So make sure you're giving it attention. And we're just kind of working on the calf, going up and down, scanning the muscle. Any areas of high tension, I'm going to hang out there, let it relax a little bit. Feel that release, and then keep it moving, okay? Now for this particular video, I'm probably going to just do about 3 minutes on each calf. However, if you do want to do more because you feel like your calves are very, very tight, you can do that. Remember, anywhere 3 to 5 minutes. If it's your first time doing it, you might even be less because these areas tend to get very, very, very tense, okay? And we're going to switch sides just to make sure that we're going on the right side as well. Okay. Now, just like any other body part, sometimes we can tend to overuse one body part as compared to the other, especially if you are someone who has succumbed to an ankle sprain or strain. Might change the way that your gastrocomplex is kind of responding or working for you. So it's important to make sure that you are giving both sides of your body equal love, okay? You don't want to just do one side, oh, this is the side that hurts, I'm good, and the other side, okay? Often what will happen is we will compensate on one side as compared to the other, and that can cause excessive tension to generate into the muscle. So keeping this in mind, you want to make sure that you're doing both sides as much as possible. And we're just going to do this. And actually this side's not too bad. Let's go on the outside now. Okay, well everyone, my battery's about to die, so I'm going to end the video here. That is the gastroc soleus complex percussion massage gun release. I hope you like this video. Make sure to give yourself time and attention. Our bodies need it. Thank you so much for watching. Please everyone, make sure to hit the like and subscribe button, and I'll see you on the next video. Thank you everyone.